Laparoscopic surgery concept is where we operate via keyhole or minimally invasive access procedures, where we make tiny little cuts, not more than a centimeter long, and we access the abdominal cavity. Through this, we then insert various ports, which are our access points for the abdomen. And using those ports and the camera, we get to visualize the entire abdominal cavity very well. And we can use the different ports to place our instruments and perform surgery. We access the abdomen through different points. And while looking at the screen, we have to work with our hands below us. It takes a lot of hand-eye coordination and a lot of apprenticeship and practice in order to be able to effectively perform laparoscopic surgery. The biggest advantage of laparoscopic surgery as opposed to traditional or open surgery is the fact that we use much smaller incisions and access points. This leads to far less post-operative pain for the patients, and they can get back to their normal daily activities much sooner rather than later. The other advantage, which translates from this quicker recovery, is that they spend much less time in hospital. For example, I mentioned that traditionally for gallbladder removals, patients stayed back in hospital for 5 to 7 days post-surgery, and now it's done on the same day and they can be discharged on the same day. The other advantages of laparoscopic or minimally invasive surgery are that you tend to manipulate much less because you're focused on one area that you're operating on. You can imagine if someone is performing a big open abdominal surgery where they cut from top to bottom, invariably there's a lot of manipulation of the intestines that takes place. That leads to a bit of laziness and a bit of trauma to the intestines, which takes some few days to recover. But in the case of laparoscopic surgery, where you have minimal manipulation of the intestines, patients have their GIT function recovering quite soon, and they're normally eating and drinking by the next day post-operatively.